Dear viewers, welcome to our TV show Take Care. My name is Dr. Ahmad Alhalabi. I am a vascular and endovascular surgeon, and I take care of patients with vascular disease. A common thing I have to explain to my patients is the so-called anesthesia. So when we decide that this patient has to undergo a certain surgical procedure or intervention, the first thing they will be asking about is, Doctor, does it have to be under general anesthesia? And today, I'll be talking to you about the three major different types of anesthesia, which is basically pain control, for procedures we perform in vascular surgery. And why is it sometimes a better idea to undergo general anesthesia rather than a local anesthesia? I understand that some patients are afraid of undergoing general anesthesia due to the impression that that might be dangerous to them. So let me explain to you, it's not really that way. The risk of anesthesia depends basically on the patient. So a 20 years old patient who would be undergoing varicose vein treatment, that's a procedure that would only last 30 minutes, doesn't really entail any bleeding risk or risks or pressure on the heart or on the blood vessels, doesn't have the same risk of anesthesia as an 85 years old patient who has had multiple strokes and multiple heart attacks and multiple procedures done on him previously. So let us really not compare these two groups together, and let us not consider the whole issue of general anesthesia in one particular perspective. The three types of anesthesia we use in vascular surgery are basically the general anesthesia. So in case of general anesthesia, the doctor will be giving you drugs that will put you to sleep. He will be monitoring you in a very detailed way using his monitor that will be looking after your heart and after the amount of oxygen in your blood, after your blood pressure and the rate at which your heart is beating per minute. And then he will be attaching you to a machine that's going to take care of your breathing. So this machine would accurately give you exactly the amount of air that you will need while you're asleep. This type of anesthesia has really multiple advantages for the patient and for the doctor as well. For the patient, it means that he's completely asleep, he won't feel anything of the procedure, even the stress of it, especially that many people don't like being present in the operation theater. For the doctor, it means that he will be performing the procedure in a detailed and complete way, and exactly the procedure demands, without having to worry about pain as a factor that might limit his options during the surgery, which would give him the chance to perform better. Yes, some patients might have allergies. Some of them might be affected by the anesthesia and having nausea after that. This is something you might be able to discuss with your doctor. The second type of anesthesia is basically numbing up the nerves of a particular organ when we target them using ultrasound with special medications. So it's very simple. If we want to do surgery on the arm, on the arteries inside your arm, for example, the anesthesia doctors might be using ultrasound to exactly and in a very detailed way target the nerves that are responsible for your arm, find them with ultrasound, and inject the medication directly around the nerves, causing your arm to become numb while you're still awake. This method is very effective, but it only works if we are operating a certain part of the body for which the particular nerves can be targeted with this anesthesia. The last type of anesthesia is the one we all know, which is basically the local anesthesia. It's injecting the so-called anesthetic, which is the medication that would cause numbness and lack of pain, exactly and directly into the region we might be operating. This would work if we know exactly that we'll be operating on this amount or this area of the skin. However, if we have to dive deeper to look up for vessels or structures that are much deeper below the skin, in this case, it wouldn't be really a good idea. Just consult your vascular surgeon if you have any questions about the right type of anesthesia for your vascular intervention. Thank you very much for watching, and take care.
Hello, our dear viewers, and welcome again to the Take Care Show. Your host here is Dr. Anwar Alharbi. We are going to talk today about database protection. Databases are very important because they have all the data for everything, perhaps if it is organization, it is a government body, private sector, government sector. Those databases are very important because we keep all the data, the raw data, for all the employees, for all the students, for all the patients. So those databases need to be really looked very carefully at. And we need to take care and protect those databases one way or the other. How can we do this? Well, this is an important question, to be or not to be. This is one thing very important, is the access control. Who is authorized to access those databases? This is very important. Is everybody allowed to? Can we grant anybody the authority to access those databases? Well, this is a high risk. We are putting ourselves at a high risk then. Because if everybody can go without us making sure that the authority of this guy or her or him is really appropriate authority to get into the database, which is he must be an employee and authenticated, and he is allowed to do so with the experience, with the CV. These are the important factors for anybody to enter to those databases, because anybody can do any harm to those databases. For example, let us say there is an Excel sheet for everybody. There is an Access database. There are so many SQL database. These databases are very important to be intact. Nobody touch them. Once the data are there, we keep them, we protect them. How do we do this? One way of doing this is the access control. This is one thing. The other thing is the encryption. We have to have some sort of encryption on the databases. We cannot allow anybody to go, even with the authority. We have to encrypt. And this encryption has to be done periodically, every now and then, so that we can know that this data is really fully protected. The way of protection is, of course, it has to be done by the experts. It's not somebody, just a new employee can do the protection of these databases. This is very important, because anybody can change the protection, the password, let us say, whatever it is, the firewalls perhaps, whatever it is, for those databases, then we are at risk, because those databases has and contains all the data, for example, for citizens, for the employees, for the patients, and the students perhaps. And anybody, just suppose I used to be a database administrator at some stage, sometimes at the Public Authority for Applied Education and Training. Can you imagine that all the students, we have 20,000 students. Can anybody from the database center enter those students' record and perhaps can change the marks, the gradings, for example? Isn't that risky? Wouldn't that graduation sheet will be false after a while? Well, this is it. So it is risky, the thing, not to protect the database. Yes, it is a risky thing. Who is allowed to do this? There has to be level of authentications. When we say level, nobody, one person, has to be a committee, as a matter of fact. We used to have a committee because sometimes professors want to change the grading for sometimes they have reset or anything. Then they come to the committee approve these changes or not. And this is the way to protect our databases and our data at our places. With this, we come to the end of the Take Care Show. Until next time, take care and goodbye.